A very good morning to Sister Deepthi and dear batchmate. I, Ayushi Gupta, BSc Nursing second year. Today I am here going to give a presentation on pharmacological topic that is anti-scabies drug. What is scabies? Scabies is a contagious itchy skin condition that is caused by tiny mites. It is the itchy skin condition that is caused by small mites that are Sarcoptes scabi or Acarus scabi. It is more common in people with poor hygiene. It is more common in dead people who not maintain the proper hygiene, and it is easily transmitted by close contact with an infected person. It is more easily transmitted by close contact with an infected person with infected article and other sharing something. Here I have taken two drugs. First lindane and second permethrin. Firstly, we will discuss about lindane. What is lindane? Lindane is an organochloride compound. Lindane is a composition of chloride. You might be heard about gamaxine and DTT. These are the parasiticide. Lindane is an also in parasiticide. It is an ectoparasiticide and ovicide. Ectoparasite who lives on the skin, not under the skin. Ovicide give the lay the egg. Lindane used in the treatment of scabies and pediculosis. Mechanism of action. How lindane act against the parasite. Lindane appears to inhibit the neural function of in arthropod. It inhibits the neural function of arthropod, causing neuronal hyperactivity. After directly penetrating the parasite exoskeleton and their ova, it penetrates the exoskeleton and their ova of parasite. It results neuronal hyperactivity. I hope you got it. Doses and route. How amount we use lindane? Be used commonly 1% lindane. How we apply? Apply a thin layer of the lindane lotion over all skin below the neck. We apply lindane all over the skin below the neck and wash off 8 to for 12 hours. For adult, we use commonly 1 ounce but not more than 2 ounce. Root. We use topical root. Indication: whom to give the medication of lindane. This medication used in parasitic infestation of scabies and pediculosis. If patient is suffering from the parasitic infestation of scabies and pediculosis, we use the lindane. Here lindane cream is there and right side lindane scrub is there, lotion is there. Now we will discuss about side effect of lindane. What are the side effect? Dizziness means rounding around, spinning sensation may be there. Seizure means convulsion may be there. Drowsiness means tired and sleepy during daytime. Skin rashes may be there. Burning may be there. Irritation of the skin, itching in the skin may be here. Adverse effect. What are the adverse effect with lindane? CNS toxicity. We have studies already. It causes the hyperactivity in the neural function of arthropod. It may be sometimes cause the CNS toxicity in human also. Ataxia means loss of coordination may be seen. Cardiac arrhythmia means abnormal breath rate. It may be the sometimes slow and maybe the high. Nausea vomiting may be seen. Contraindication: whom to not give the medication. Patient with hypersensitive to drug or its product. If patient is hypersensitive to lindane and its product, we have not prescribed the lindane. Second, seizure disorder. Third, inflamed skin. If patient is having seizure disorder and burned skin, we have not prescribed lindane to that patient. Drug interaction. Sometimes some drug interact with other drug. If we use along with, in the case of lindane, do not apply other topical preparation to the affected area during treatment with lindane topical. It may interact and increase the risk of seizure. If we use the lindane topical, we have not used other medication along with. It may be the interact and increase the risk of seizure. Toxicity. It is quite toxic to human through inhalation exposure that result irritation of nose and effect on the blood. If we inhale the linden, that results irritation of nose and it may be the effect on the blood. Permethrin. Now we move toward the second drug, that is permethrin. What is permethrin? Permethrin is an insecticide. Permethrin is the kill the insect, that is synthetic parathyroid. It is the synthetic parathyroid. Parathyroid has the organic compound similar like the perithrin. Perithrin is the extracted from natural flowers of perithrum, and it is neurotoxin also. Mechanism of action: how permethrin act against the parasite. Permethrin act on the parasite's nerve cell to disturb the sodium channel current. Permethrin act against the parasitic nerve cell and disturb the sodium channel current and causing the parasitic paralysis. I hope you got it. Dosage and route. Permethrin medication apply all over the skin from head to sole of the feet. As same linden, we have also apply permethrin all over the skin below the neck, and it including the nails and skin fold between the toes also and under the skin may be used, and wash off the cream after 8 to 14 hours. We use commonly 5% cream and 10% lotion. True topical use: here permethrin lotion is there, and right side permethrin cream is there. What are the side effects with permethrin? Pruritus. Pruritus means itching skin condition. Tingling sensation may be feel sometimes feeling tingling in the feet and some other areas. Burning sensation may be seen, and edema. Edema fluid filled sometime may be seen on the skin. Stinging. Stinging means pinning sensation may be feel sometime. Touch the sharp instrument on the skin like feeling in card stinging. Scalp numbness may be seen and discomfort may be seen. Mild erythema. Erythema means redness. Mild redness may be seen on the skin sometime, and scalp rashes may be seen. Adverse effect. What are the adverse effect with linden? Permethrin, sorry. Permethrin, first burning. Burning may be seen. Stinging, pinning sensation may be seen. Pruritus, itchy skin condition may be seen. What are the contraindication with permethrin? First, hypersensitivity. Hypersensitive. If patient is hypersensitive to permethrin and its product, we have not prescribed the permethrin to that patient. And second, infant less than 2 months. If infant is less than 2 months, we have not prescribed the permethrin to that infant. Drug interaction. Permethrin has no known serious, moderate, and mild interaction with other drugs. It has no serious and moderate and mild interaction with other drugs. Toxicity. Toxic exposure of permethrin can cause several symptoms. If we expose is toxic exposure of permethrin, can cause several symptoms like convulsion, seizure may be seen, and loss of coordination, ataxia may be seen, and hypersalivation, over secretion of the saliva. What role of the nurse? What are responsibility to administer permethrin linden in the patient? First, use estimate amount of cream needed as per application. Use appropriate and needed amount of the cream and lotion as per application. Do not apply drug to inflamed or raw peeping areas. If patient having burning skin and dry skin and peeping area, if discharge is there, secretion is there, we have not used these medication in that area. Third, patients should be instructed on proper use of medicated cream or lotion, especially amount to apply, how long to leave the lotion or cream. Nurse should be informed to patient use of proper use of medication cream or lotion, especially which amount we use, and how long to leave the lotion or cream on the skin, how to apply, etc. Fourth, patients should be informed that itching may occur and may worsen after successful killing of scabies. Patients should be informed earlier. It may be itching may be seen after the killing of scabies and scabies after the successful treatment. Fourth, nurse makes sure hospitalized patients are placed in isolation with special linen handling precaution. Nurse makes sure that hospitalized patients should be placed in isolation area with uh, special and use the special precaution during handling the linen and infected article with infected person until treatment is not completed. Now we have we will study about its special instruction regarding the permethrin and linden. Linden used costly in the infant, children, elderly patient. All are at gutter tricks for CNS toxicity. As already we have read about read about it caused the CNS toxicity. Then we have costly use in infant and children and elderly patient. And permethrin not used less than 2 months of infant. Permethrin do not use less than 2 months of infant. Last, provide psychological support to the patient and follow up the care. In some time patient is hopeless, then we have to provide the reassurance and psychological support to that patient and instruct the patient follow up the care. Now I want to summarize my topic. Today I have discussed about scabies. Scabies is a contagious skin condition that is caused by Acarus scab and Sarcoptes scabi. In this we have discussed about linden and permethrin. Linden in and its indication, mechanism of action, contraindication, adverse effect, side effect, drug interaction, toxicity, and nursing responsibilities. I have taken the content from the Sarma K. Suresh Doctor Textbook of Pharmacology, Pathology, and Genetic for the Nurses, first edition 2016. The Health Science Publisher, page number 8729. Mosby 2020 Nursing Drug Reference, third edition. Third is www.mapmed.com. Fourth is www.netlibrary.com. I hope you all got it the content. Thank you everyone.